A very good evening to all, and thank you very much for joining us this evening. I would rather call it a fateful evening as we discuss an integrated approach to combat COVID-19 pandemic. The COVID-19 pandemic has been hitting us very hard with all the problems and issues coming up with the second wave, third wave, countries back in Europe going in second or third lockdowns. So it's become a rather serious issue than what we had envisaged. And I think it's time to not only put our efforts together, but put our knowledge, experiences, and understanding of the disease as well as its cure together to make sure that whatever we do is the best effort from all the medicine systems. I would now request my colleague Siddharth to kindly read out the profiles of the speakers who are there on screen. Can you please go ahead, Siddharth?
Sure, sir. Very good afternoon, everybody.
Good
Uh,
afternoon.
I would like to start with Dr. T.S. Clear. T.S. Clear is the chairman of PSRI Heart Institute. Born in Amargarh, a small village in Ludhiana, he got his medical training from College, Patiala. Dr. Clear spent 28 years of his career at Fortis Escorts, Delhi, as a consultant, senior consultant, and last 12 years as executive director. Dr. Clare's main interest is electrophysiology and interventional cardiology. He also started ICD implantation and RF ablation program in many centers in India and almost all SAARC countries including Sri Lanka, Nepal, Bangladesh and Pakistan. He is also very active interventional cardiologist and has performed more than 20,000 coronary, renal, carotid and peripheral angioplasties. He is regularly invited as guest faculty at national and international conferences and has authored more than 270 publications. He has also trained more than 300 cardiologists from India and abroad in the techniques of electrophysiology and interventional cardiology. Uh, I would now like to proceed to Mr. Sava. Mr. Sava is the MD of Vyom Digital Services Limited and CEO of Technology Partnerships, software solution provider company based in Belgrade, Serbia. Mr. Sava is an engineer with many years of experience in the business. Mr. Sava graduated from Faculty of Electrical Engineering in Belgrade and after that traveled to UK to finish his master's degree in financial risk. He lived in UK for 9 years, where he gained many experiences in the industry. He came back to Serbia to find his company, Technology Partnership. Some of the company's significant benefiting projects are Telehealth by PI Platform, and Medic Arc. Dr. R.N. Vahi. Dr. R.N. Vahi is a homeopath physician, Vice President, South Delhi Homeopathic Association. He was born in Chandni Chowk of the old Delhi area. He has done schooling from a reputed school in Delhi itself. He entered the professional practice in that year itself. Later on, passed on to the post graduation in rehabilitation medicine from All India Institute of Physical Medicine and Rehabilitation, Bombay. He holds various positions right from being an executive member to the president. On behalf of Delhi Homeopathic Chemists Association, he has played an important role in making the proposed regulation for drugs and cosmetics rules 1945 as applicable to homeopathic system of medicine. He has also played an active role in getting certain important clauses introduced in the Central Council of Homeopathy. Dr. Vahi has also played a proactive role in getting Delhi intoxicating spirituous preparation rules scrapped from getting their applicability to the homeopathic medicines. He has also been associated as a joint editor of monthly journal of association named Hanumanian Homeopathic Sandesh. Dr. Himanshu Tiwari. He is a medical advisor at Multani Pharmaceuticals Limited. Dr. Tiwari has completed his BAMS from Delhi University and MD in Ayurveda from Gujarat Ayurveda University. Dr. Tiwari has more than 20 years of experience in clinical research, regulatory, operations, research and development and marketing of Ayurvedic products. Dr. Tiwari has delivered many guest lectures in various topics of Ayurveda, presented many scientific papers in national and international platforms, and coordinated many clinical trials for scientific validations. Also, he has also coordinated with many certification bodies for WHO GMP, COPP, APM, ASM, and ISO. He has also numerous publications in peer-reviewed, indexed national and international journals to his credit. Thank you, sir.
Thank you, Siddharth. I think we have Professor Dr. Tanuja Manoj Nesriji also joined, who has joined us. If I can request Madam to switch on her camera. Thank you very much, Namaskar. And it's really nice to see you. Thank you. And
Thank you. My
Siddharth,
pleasure.
thank you.
Thanks. Thank you.
Siddharth, can you please read out Professor Dr. Tanuja Nesri's profile, though it needs no introduction, but we must do the honors.
Right, sir. Professor Dr. Tanuja Nisri has completed her MD and PhD in Ayurvedic pharmacology from Gujarat Ayurveda University, Jamnagar. Currently, she is working as director as well as head of division of translational research and biostatic at All India AIMS Ayurveda, basically, New Delhi. She is also a chair of the Health Sector Subscale Council for Ayush under MOA, Government of India. She has worked as CEO of National Medicinal Plant Board under the Ministry of Ayush, also as the additional director academics and medical superintendent at Chaudhry Brahm Prakash Ayurvedic Charak Sansthan under the government of NCT of Delhi. Uh, and many other positions she has held. Currently, she is member of Governing Council of IMS BHU. She is a member of General Assembly of ICCR, member of Board of Governors CCIM, and convener of Working Group 3 Clinical Practice on Formulation and Integrative Health System. She is also a member on the academic board of various universities like IPGT and R Jamnagar, and national academic and research bodies, and involved in academic administration, curriculum, syllabi development, and policy making for effective education in Ayurveda. She is the board member of International Advisory Board of Jivaji University, Gwalior.
I think
She is
maybe I am really thankful if you give me one more time to give my presentation instead of my biodata. Thank you very much.
Right, right, right. Absolutely right. And that was quite a mouthful. And thank you, Siddharth, for introducing all the panelists.
thank
And
you,
I
sir.
must thank our chair of the Ayush Committee, Shri Arvind Vastasviji, for joining us this evening. He is not only the chair of the Ayush Committee of PhD, but he's also the MD of Siri Siri Tattva, the uh, if I can use the word flamboyant, and very actually the leadership of Shri Ravi Shankarji, and supplies a lot of products which are related to Ayurveda. Thank you very much, sir, for joining us. I think the reason why we are all here together today is because the COVID-19 force is only getting stronger by the day, coming back in the second and the third waves. And I think we have stalwarts from each of the fields today here. And one of the reasons we also have Professor Nesri is because we're going to talk a lot about how do we actually integrate, or how do we actually take an integrative approach of to combating for combating COVID-19. We have Dr. Vahi, who's a very well-known homeopath, going through a quarantine right now, just passed through a COVID-19 attack himself at an age of delicate age of 82. We have Dr. Himanshu Tiwari, who is Ayurvedic consultant and a physician working with Multani Pharmaceuticals. And of course, we have the well-known Padma Bhushan awardee, Dr. T.S. Clare, who is very well known in the medical fraternity for cure of cardiology and other related problems. Um, I'd like to now request our chair, Mr. Arvind Varchasvi, to kindly start the discussions by offering a welcome address.
Thank you very much, Vivek. It's a pleasure to be here with all of you. At the outset, I would like to wish you and also your family the best of health during these very troubled times. So good evening all. On behalf of PHDCCI Chamber of Commerce, I would like to welcome our panelists of the session, Professor Dr. Tanuja Manoj Nesriji, Director, All India Institute of Ayurveda, Ministry of Ayush, Government of India. A very warm welcome to you, Madam. Dr. P.S. Clare, Chairman, PSRI Heart Institute. Pleasure to have you here, Doctor. Mr. Sava, Managing Director of Biome Digital Services Limited. Dr. R.N. Vahi, homeopathy physician and also Vice President of SDHA. Dr. Himanshu Tiwari, medical advisor, Multani Pharma. And of course, my very good friend and today's session moderator, Mr. Vivek Sehgal, Principal Director of PHD Chamber of Commerce. Ladies and gentlemen, the PHD Chamber of Commerce has been working as a catalyst for the promotion of Indian industry, trade and entrepreneurship for the past 116 years. It is a forward-looking, a proactive and dynamic pan-India ethics organization. As a partner in progress with industry and government, PHD Chamber, with a special focus on MSMEs, works at the grassroots level. Strong national and international linkages for propelling progress, harmony, and integrated development of the Indian economy. The PHD Chamber is one of the premium chambers in India to have been accredited with a diamond grade by the NABET, that's QCI, at national and international levels. The PHD Chamber of Commerce reaches out to more than 150,000 companies with total focus on development of small and medium businesses. PHD Chamber of Commerce has co-opted national and international industry associations and organizations through over 100 MOUs signed between the parties, and also has sent a lot of representations to government regulators to benefit the industry. The PHD Chamber of Commerce has more than 202 associate members, including Ayush industry associations, including one of the prominent associations being AMAM, the Association of Manufacturers of Ayurveda Medicine. Today, the entire world is going across through a very unprecedented outbreak, which has really plunged economies into a deep coma. As we strive to fight the novel COVID-19 called the coronavirus, India has braced itself for an unexpected by shoring up healthcare and pharmaceutical industry to ensure that the public healthcare system is not burdened by the onslaught of the cases. From educating people about the virus itself to capacity and also capacity building in the health workers, and also ensuring availability of test kits and also therapeutics to meet domestic and export demands. There's been an immense cohesion in India's approach towards the pandemic. The Honorable Prime Minister of India has also highlighted earlier that India's fight against the coronavirus is going on very strongly, and people have saved the country while facing difficulties. He also urged people to respect the corona warriors, doctors, nurses, sweepers, and also the police personnel. He mentioned holistic and integrated approach and timely decisions have put the country in a much better position compared to the most developed countries in terms of the numbers of people being affected. Modern medicine is an evidence-based system of medicine, and its high-end investigative tools, surgical procedures, and also continued research at molecular and also genetic and also pharmaceutical levels. Ayurveda is an integrated system of healing that originated in India thousands of years ago. It is designed to promote good and health and also longevity along with treatment of diseases. It would be more apt to call Ayurveda as a completely natural way of life. Homeopathy is yet another system which is prevalent and successful with its nature-based extracts and medicines. But the fact is there exists a wide gap between these three healthcare systems. None of these medicine systems have had any replacement, and also the traditional healthcare providers still form the basis of rural healthcare in India. There's a need for integrating the allopathic system with Ayurveda, homeopathy, and also other systems of medicine. we would like to emphasize the role of our traditional healthcare systems, including yoga. A time has come to build the bridges between traditional and also the allopathic healthcare systems through an integrated approach towards holistic health. WHO is halfway through implementing the WHO Traditional Medicinal Strategy 2024 to 2023. Our current focus is to develop norms, standards, and technical documents based on reliable information and data to support member states in providing safe, qualified, and effective traditional medicine services and their appropriate integration into the health systems for achieving universal health coverage and the sustainable development goals. This is the right time for WHO to also speed up its efforts in providing technical inputs and scaling with the standardizations and specifications. It is also important for WHO to work as an umbrella organization for the development of vaccines and also cure for COVID-19 using their knowledge and also the experience of the allopathic systems and also the traditional systems of medicine of different countries. Today, we have panelists from industry, hospital, and also from the All India Institute of Ayurveda. We are sure that with the efforts of the chamber, with the support of the Ayush industry and also the government, we will be able to fight this pandemic with an integrated approach. Ladies and gentlemen, on behalf of PhD Chamber of Commerce, I once again welcome all of you and look forward to your active and valuable participation in this important session. Having said that, I would like to mention that India perhaps is the only nation that has really seen how it's brought its system of medicine that's been there in its country, whether it's Ayurveda, Yoga, Unani, Siddha, or homeopathy, and also making it as a part of the essential services. And it shows that how serious the government is to ensure that these systems of medicine are given good amount of encouragement. And I think over the last couple of months, Dr. Tanuja Nestri will be sharing with us. There have been a lot of clinical trials that have happened, and more than 60% of the clinical trials that have been registered here in India, all of them come across from the Ayush systems. And this is something very encouraging. Even from Shrishi Tattva's side, one particular data point that I would like to mention to all of you is that recently we did a research with the Frankfurt Innovation Center for Biotechnology in Germany, which is also a quasi-government body over there. So what they realized is that the Siddha medicine of Kabasura Kutinir and also our Giloy Amrut and also our Chavanprash. Giloy and Chavanprash showed about 75% binding in the ACE2 receptors of the SARS-CoV-2 strain. But whereas Kabasura Kutinir, the Siddha classical formulations, showed binding up to 84% in the inhibitory part. So that shows that there is so much that what our systems of medicine have to offer, and this would be extremely encouraging. And I really look forward to all the panelists and listening to what wonderful wisdom they have. Thank you very much. Thank you very much, Vivek.
Thank you very much, Arvindji, for those initial opening remarks and welcoming the panelists. And of course, talking about the role of organizations like WHO, which can play an important role because they have been working in the what they call as traditional and complementary medicine, TNCM, for quite a few years. I think the way we would like to go about is to actually have all the panelists talk about their own experiences, not only in their particular sectors or in their particular pathies for that matter, and then also more emphatically get into what are the opportunities and areas where integrated medicine can actually help and what are the efforts going on with their particular pathies so far as integrative medicine is concerned. So at this point of time, may I request, as they always say, ladies first, may I request Professor Tanuja Manoj Nesriji to kindly give her opening remarks on this subject.
Hello?
Yeah, Professor Nesri, we can hear you.
Yes, Doctor, we can hear you.
What is the timeline which I'm expected to
How much time would you like to take, ma'am?
No, no, wait, I have one presentation also ready. So the
Right.
participants, I would share the AI experience and Ayush experience also.
We've
So
lost your voice in the
yes,
middle.
can you hear me?
Yes, we can hear you
Yes.
now.
So actually, I'm really thankful to PhD Chamber Dr. Mr. Saigalji and Arvind Varchasvi and all the esteemed panelists and the audience and the experts. It's really great honor and pleasure to have uh, sharing this experience of Ayurveda in and AIA in the COVID pandemic, especially what we have been doing. Our committed team of All India Institute of Ayurveda under Ministry of Ayush is really working hard since last 9 to 8 months, and in the field of preventive, promotive of the health prevention, prophylaxis, management, and also post-COVID management. So, if given a chance, I would like to share uh, within few minutes the data what we have been achieved. We are achieving since last few couple of um, months. So, may I share the PPT?
Yes, please do. Please
Okay,
do.
thank you very much.
And if you can also outline the facts as to what kind of support would you look forward to from Ayurveda, homeopathy, and the modern medicine sectors, because we have the specialist here also, so that
Yes.
we can have a reasonable outcome of the webinar
Thank you,
on
and
that front.
I really congratulate PhD Chamber for organizing first of its kind experience, a kind of webinar on integrated approach to combat COVID-19 pandemic. And as this virus itself name is a novel coronavirus, everyone is learning. Everyone was learning. The pathophysiology, earlier it was inflammation, then it was like thrombosis, and then cytokine storm, and then the coagulation profile told that says that it is the D dimer and the ferritin, and those are the markers which are really uh, telling us about the severity of the condition. So, since beginning, All India Institute of Ayurveda, we integrated in terms of understanding capacity building. But most important, I would like to share with the esteemed audience that we did integration in all four levels, like the integration with the infrastructure, as all the you may appreciate that all the Ayush infrastructure of the hospitals, even though All India Institute of Ayurveda is a tertiary care hospital, aims for Ayurveda, but we had to really change our infrastructure which suits to the treatment of communicable diseases, because the Ayurvedic setup is mainly for the strength of Ayurveda. That's the non-communicable diseases. So that also took some time for us to upgrade our infrastructure, and more was the capacity building and create an awareness. It's very important. It is not only the physician which needs to be trained, our postgraduate scholar and all our uh, doctors. It was not we really give the training of the infection control management, and also the biomedical waste management to our housekeeping, security, paramedical staff, and all the nurses. So as Ayurveda says that it's the management system, and it has got all four pillars like Rogi, Aushad, Paricharak, and Vaidya. So we have given the training. It's a continuous education cell which gives training to daily update about the corona, how to deal with, how to even wear the PPE, donning and doffing, and the infrastructure, green zone, orange zone, red zone. So this is how the infrastructural challenges we could really come across, and we could really upgrade our infrastructure. And coming to the prophylactic and the clinical practices, the practice level, the clinical protocol, the SOPs had to be prepared for each and everything, not only biomedical waste management or infection control, but also for all small things, how to welcome the patient and how to give the treatment, and a holistic protocol of the integrated practices from morning to evening in the COVID Health Center of All India Institute of Ayurveda, where the title itself says that it is care with compassion. So when the everyone is addressing that there should be physical distances, and the patient comes with lot of stigma and hopelessness, and like he feels that I'm untouchable. So this is what the challenge we here give the feeling to each and every patient, that he lives into the in his family and there is a human touch, and he is a socially connected and more recreational and the counseling activities, and he is involved in many activities. And we say that here you are, we are here to offer you not from your illness to wellness, but also the happiness, happy state. So this is what really that protocol of how we do recreation. Morning hours, our patients say that he is awakened by the chanting of the mantras and the yoga and meditation, guided meditation, along with the decoction, and along with the different Ayurveda intervention procedure like Jalaneti and yoga, and all these advisory of Ministry of Ayush. What was for the physical measure, general measure, and the specific measure, we have practically implemented that. And till now, I'm really happy to share that we have treated 400 patients successfully. And as there was a report, uh, and asking the question about the evidence, but this I must share that it is a practice based evidence, because out of 499% of the patients have been cured, they have discharged as a cure, and 94% of the patient have been given standalone holistic Ayurveda protocol. And 4% definitely had integration, but I must share here the integration with the diagnostics, integration with the oxygen therapy, because the like future of the medicine is integration. So we have the availability of the doctors, we have the medical doctors, co-location of the emergency medical doctors, we have oxygen support to each and every bed, we have ICU department, and to each and every patient we have testing center, one testing center in Delhi. So uh, we take their blood, and RT-PCR swab is also it's taken, and the immunity inflammatory markers, immune markers are also being tested, X-ray, ECG, pre and post. So the outcome is the mean recovery time, which was 14 days, and average it is not less than 9 days, but here the average mean recovery time has come down to 6.5 to 7 days. So this is the achievement I can say that what we have achieved so far in care with compassion. And coming about the healthcare workers, so till 15th batch none of our healthcare worker was found positive, because of the safe environment, and the training is most important, integration in the academics is very important. And coming to new normal, I just go quickly now because I understand the time is very important and the constraint. So I just say that during the advisory, as ministry notified the advisory, and we also did many campaign and the media outreach program, where now you can see there is from 5 to 30, it is like 20 to 40, and some products like Chavanprash, everyone must appreciate that it is like 200% increase. And in some products of Ayush products, And wellness industry, you can see some is more than 70% rise. So this is what is the, and now like in academics, we are preparing for the new normal. Here we are connected, physical distance but socially connected with this learning management system. So that's how we are really trying to acquainted with the new normal in the academics, in our research, and in COVID pandemic. And this is very important aspect. As you know that as the advisory was floated uh, on the ministry's website, and we practically implemented at All India Institute of Ayurveda, where all our workers, till now we are comparatively safe, very safe. Very few of our workers have got infected, but 99% of our workers are safe because of the advisory. And the Sanjeevani app, the responders are 1 lakh, as CCRS report says that 1 crore 87 lakhs. And amongst those, 87% responder reported that 87% of the population is consuming some or the other immunomodulators. That is the pre-corona and the post-corona booster to the immunomodulators. And when we say that, till now lot has been spoken today also about the vaccine, but till now, till today, there is no vaccine nor the solution. So all with the empirical evidences, whatever even in the conventional medical doctors are giving, and we are also giving our age-old wisdom with the immunomodulators. So when we say that जब तक दवाई नहीं ढिलाई नहीं and 2 गज की दूरी, but we say that Ayurved है जरूरी, because जब तक दवाई नहीं, but Ayurved है जरूरी. That's what is the our experience tells. And when we say that number of cases are on the rise in Delhi, because it is the third wave, third spike in Delhi, and as today's report says that Delhi has become the hotspot, like Himachal and Delhi are number one top, and Delhi infected are also more at 5%, more than 5% are infected and have symptomatic. But the good thing is that the good news is that daily cases versus new recoveries, if you look at that, so the spike of the new recovery is more than the spike of daily cases. So this is also the encouraging, and that is because of maybe our awareness programs and some or the other immunomodulators from Ayush system, each and every family is consuming, because this Ayush has been imbibed in our culture. And coming to Delhi police, as Honorable Prime Minister also mentioned about frontline warrior. So we are the one who have really created this history in this Corona pandemic, that this has been given to largest cohort, 80,000 police personnel, and our all study duration has been completed, and we are collecting the data, manage documentation, and will come out with the publication. But the initial trend, I repeat, I am not claiming, but the initial trend suggests that there is a less mortality. Today also, mortality rate in Delhi is 1.5. But compared to Delhi, who are the frontline warrior, the mortality rate is point below 5%. So this is a significant achievement. And coming to All India Institute of COVID Health Center, today we have, you can see it's a 99% recovery, and 355, 352 totally cured, negative tested, asymptomatic. That's the I can say the what evidence we require, because it is a practice based evidence, and we have negative asymptomatic lab reports are there, and also we have X-ray, ECG, coagulation profile, and we can say that our patients are safe physically, mentally, and spiritually. And they say that I have become negative, but I am going back positive with the positive attitude. And this is how the role of Ayurveda, I'll not touch upon, but I'll just say in this Corona pathophysiology, physical, general, and minimizing the entry, replication, controlling replication, and target organ damage. Ayurveda helps at all level, and we are really helping at preventing, stopping replication, and controlling rehabilitation. And we have done all prophylactic symptom management and post-COVID management, and our success stories have been really helpful to Ministry of Ayush to include these into the national protocol. And that's really, we are really happy that we are the implementing agency for the ministry. And whatever the success stories we create, it helps in the ministry to include into the national protocol. So that's the great service of humanity we have taken, and these are some of the measures. I'll not repeat, but this I think template will be really, really be helpful, because this is a spreadsheet that summarizes what we are doing as a holistic integrated protocol from morning to evening, from gargling of the haldi kadha and with the turmeric latte and decoction and Sanshamani Vati and Sudarshan and Ayush 64 till Bilvadi Kutipar, what we are giving, doing to pre-symptomatic, asymptomatic, mild, moderate. Let me clear here that this is the red zone we are not touching. We are referring to the higher center, and we have integration and a very good rapport with our higher centers, with AIMS, with Rajiv Gandhi, with LNJP, and we have a telemedicine and teleconsultation. Even in the emergent cases, when SpO2 goes down below 90 and there is a respiratory distress, we don't touch it. Even our one or the two very senior doctors we have referred to AIMS, but fortunately we have been safe, and not the disease has been not progressed to 99% of the patients who have been admitted. And these are some of the rasayanas. I should not repeat because everyone knows this, as the kuduchis, like even in All India Institute of Ayurveda, I must say that our purchase department tells us that there is a 200% increased demand in Guruchi, because we have given distributed Ayu Raksha kit, not only to Delhi police, but whosoever comes to All India Institute, we distribute them this Ayu Raksha, Chavanprash, Amalaki, Amalak Rasan, Amalya with Haldi, and Nimba, yes. The research project, because Arvind Varchasvi mentioned that apart from academic, clinical activities and preventive, we are doing research, 11 double-blind controlled clinical trials, and one of them is Nimba Directa Indica as a prophylaxis with the medical college at Faridabad, and you will soon get the results of what is the exact biostatistical after evaluation, what is the, see whether it is significant, but very few of them they have got tested positive. There is a significant prophylactic and about turmeric haridra. And one thing I would definitely highlight that it is not only Guduchi, but Guduchi with Pipli is the one combination of Sanshamani Vati, which is very useful in this current pandemic situation. That's our observation, and we are doing this study for understanding molecular mechanism with our IGIB, and ILBS. Also, one study has been conducted, and these are some of the herbs which we have integrated into our practice. And this was the success story of Ayu Raksha project, which I have already shared, that really the mortality rate and the number of patient getting, police personnel getting daily infected had come down significantly. Some of the pictures, very importantly, that it is not that we are giving this to our patient, but our healthcare workers, they are doing the same. So we say that practice before we preach. So our telecare workers, they are also getting benefited with all this strength, and we can really through this pandemic and post-COVID management in the new normal, I'm sure Ayurveda would be the way of leading healthy and happy life. Thank you very much. Thank you.
Thank you, Dr. Nesri, for a very nice and a positive outlook towards the entire situation and how you're handling it at AIMS. It's really very encouraging. I'll just quickly ask you a quick question, because I will come back to a similar question when I speak to Dr. Claire next. Um, you know, Currently, since you are a hospital and so does Dr. Claire run a hospital and controls a hospital, what is it that you would expect from the modern medicine or homeopaths like Dr. Wahi to do with you at AIMS Ayurveda? We can actually bring on ground integrated approach. Like what you mentioned, of course, the severe cases you are transferring it to AIMS or LNJP or other hospitals. But even in the pre-severe cases, do you think you need some help, support? What kind of things can be done to take the 94, 97% to maybe 99.9% of recovery rate? Over to you, Dr. Nesik, for a quick
Yeah, thank you.
response on that. Yeah.
Uh, we definitely have the oxygen support, that is a 6 liter per minute. So when the oxygen saturation SpO2 on oximeter that goes down, we have given to 8% of our patient, we have integrated with the oxygen support, and few of them 4 to 5% of the patient when the signs of like respiratory distress and the pneumonia comes, we have added only 4 to 3 to 4% of patient, we have added certain antibiotics also, like azithromycin and HCQ only to one patient we have given, and ramapril only one patient out of 400. So maybe 70 to 80% cases we treat with, but it is like a complementing, it is not competition or it is not a standalone treatment, it is integration with yoga, integration with the medicine, spiritual sciences, because it is really your moral should be very up and high, and that moral boost up and support is required. And yes, with the homeopathy like arsenicum album, if we really integrate with homeopathy also, and along with that if we give kada and diet support, I think it would also be very useful. But in some patient, like we have uh, decided, and our honorable minister also has inaugurated ICU, so we really need support in capacity building in how to handle the emergency cases there and there itself. Like we are now developing the integrated clinical practice for the Ayush system and conventional medicine also through Niti Aayog. So there are two models in India. One is a 80% Ayush system and 20% allopathy system for the emergency management in acute condition. And it is other way around, like in AIMS, there are all conventional management 80%, but integration with the Ayush practices like good diet, good lifestyle, counseling, immunomodulators. So both the models are really good, and it is a medical pluralism, cultural biodiversity of India. So we cannot enforce to each, and it is a patient centric. It is not the pathy centric. Patient's requirement are very important, and patient preference is also very important. So that's what
Okay.
I
All right. So thank you for answering that, Professor Nesri.
thank you.
I think Dr. Clare is off for a moment. He was there a while back. I would have definitely requested him to be the next speaker. However, without wasting time, can Dr. Clare, is he coming back in a minute? Okay, thank you, Dr. Clare, for being with us. I know the time of a doctor today is so valuable. We sometimes feel apologetic about asking your time, but I think it helps a lot of us out there. So, Dr. Clare, you heard Professor Nesri about her experience at AIMS and what she's doing with integrated medicine. And I specifically asked her what is it that she looks forward to from in terms of support from people like you and your institutions. And she said handling of these capacity building for severe cases is a major uh, area where they feel that you can support them. um, please let us know about what is your experience and what does your knowledge say when it comes to integrated approach. That's point number one. And if you can also share with us what are the what do you feel, is there enough being done on the integrated medicine, and what would you like to do about it, Dr. Claire?
Yeah, first of all, I want to thank Vivek, you people to invite me to this wonderful discussion actually, because we go on listening to allopathy medicine day in and day out, and this is a different kind of situation, and you're talking about something which I'm not very knowledgeable, but of course I've been hearing about the alternative medicine since I joined medical school. Now the you know the what I believe personally is that if you go to Ayurveda, Ayurveda is not only herbs. People think it is herbs. You give some jadi booty to treat disorders. Ayurveda means it's a adoption of a new lifestyle. It's a lifestyle, uh, and I totally believe that if you adopt a good lifestyle, a lot of diseases can be prevented. I will say you don't have to treat them. Actually, a lot can be prevented at a preventive level if you adopt the Ayurveda concept. Now, one of the major problem with Ayurveda or Ayush is that so far, these two systems, the modern medicine and these Ayurveda, they are they are running parallel. They are not joined together. For example, whatever studies are being done in Ayurveda, they should be modern medicine should be part of those studies. So they should be joint studies, uh, and then the results should be published in proper medical journals. See, nothing is acceptable in the world today without a proper documentation. In the good thing about allopathy is that the studies done for any new treatment, they are very, very rigorous. In fact, any drug which is tested is like a double blind randomized trial. Double blind means neither the patient knows what he's getting nor the doctor knows. So such kind of studies are lacking in Ayurveda and in alternative medicine. But at the same time, I do agree that there are a lot of good things in perhaps Ayurveda, but I think we have not been able to explore it properly. Uh, in it should be explored. All the Ayurveda good institutions should have a very, very definite, very, very clear collaboration with allopathic medicine, like already Institute of Medical Sciences, Postgraduate Institute of Medical Science, Medical Education Research, Chandigarh, and some even good private organizations which are very, very serious about research. So there should be collaborative joint studies.
Okay. Uh,
See, in
Thank you,
medicine, for
Doctor.
example, in allopathic medicine, I tell you, now Dr. Tanuja she looks very passionate and I think she's very serious about what she's talking about. But in allopathic medicine, I mean, apart from good exercise, good air, good environment, good diet, there's nothing you can do to increase the immunity. We don't have that documentation that taking garlic or taking haldi or anything else can really improve the immunity of a person. The most important thing to improve the immunity is uh, physical education, physical health, exercise, good nutritious diet, and a good positive attitude. Is very important to keep your immunity high. People who remain happy, people who think positive, they are in a better situation to fight disease. This is documented in allopathy. It is not my talk. It is published. Data. For example, if a patient is admitted with a heart attack, he has a positive attitude versus other fellow has a negative attitude. The mortality is much more in patients who are depressed, who have a negative attitude. So, in one line, I would say that there is a serious need to have a good collaboration between these two systems of medicine.
Right, Dr. Claire. In fact, I see some very interesting differences, but very interesting, more importantly, coinciding of views. I heard Dr. Tanuja Nesri talking about we don't do illness to wellness, but we do illness to happiness. And that's where Dr. Claire is also talking about, it's happiness which will bring in immunity, which will be a lot of exercise, a lot of, good diet and other things. So there you see, I think both these pathies are actually aiming at happiness at the end of the day, which is going to be the immunity builder and other things. So the question which I asked Dr. Nesri, I want to ask you, Dr. Claire, what is the kind of help or support? I know you're moving from PSRI to now the Fortis
What is
group of hospitals. So going forward, what is it that you would like to, in any case, try and help Dr. Nesri or Professor Nesri with skilling of their workforce for severe cases? But at the same time, what is it that you would like to expect from her going forward, in terms of how to work together on the joint studies which you talked about? Can you throw some light on that, please?
So it's a few things which she said that they showed the data that the by following those principles of Ayurveda, and very few of those workers got the disease, and in general the infection rate was low when they followed those principles. So that I think is a very useful thing as far as the prevention is concerned. Uh, the second thing is that as far as the uh, modern medicine is concerned, modern medicine is certainly more superior in treating moderate to severe cases. When the patients are really sick. Now, in that situation, we really need more intensivists, more ICU beds. There have been such a terrible demand for last couple of days. In fact, I'm a cardiologist. I have been busy in arranging beds for people. So somewhere along the line, I think we need to gear up more for sick patients, which is still lacking in our situation. And I'm talking about Delhi. I think the situation will be much worse in smaller towns. People don't have proper ICU critical care beds to treat those patients.
So that's again, I think, an area of working together. And I don't know. I mean, a lot of these big hospitals have integrated medicine also now, and they refer the less severe cases to maybe a Ayurvedic doctor or a homeopathic doctor or a yoga center. So one last question to you, Dr. Claire. Do you see that feasibility? Do you see that happening at least for COVID-19 as of now, where the integrated approach can bring in lesser stress on the modern medicine health system by referring milder cases to the other pathies?
Yeah, I think there is a good possibility that the integration of this modern medicine and the Ayurveda can do a lot of good to our population at large. As you said very rightly, the prevention, for example, prevention aspect is much more in Ayurveda than in allopathy. Allopathy is more aggressive to treat patients, but I think the real medicine is when we can prevent the disease. So there is a definitely a role. In fact, Vivek, I would certainly like that all these modern hospitals, maybe Fortis or maybe PSRI, they should have a department of Ayurveda, because there are many patients, even in cardiology, for example, where I don't have a good treatment of those patients, and those patients can be referred to Ayurveda. And patients who are on Ayurvedic treatment, they get sicker and they need more intensive care, they can be referred to the modern medicine allopathic doctors. So I think there is a great need to integrate these two systems. In fact, the government, for example, has a ministry, separate ministry, but I am really kind of disappointed to note that none of the modern hospitals or organizations like only Institute of Medical Sciences or PGI Chandigarh or Postgraduate Institute of Pondicherry, none of them they have Ayurveda department, proper, Ayush department to her integration. So we are beating two different drums, at a different place. So until and unless we get together, I think a lot of positivity can come only when we sit together, do joint studies, and then I think the best utilization can be done of both the systems.
Wonderful, wonderful, Dr. Claire. I think you brought out some very, very good thoughts and actionable points for the integrative approach. Good time for me to bring in, I think, Dr. R.N. Wahi, renowned homeopath, as well as as recent as now, I would say, going through a COVID-19 quarantine and curing, if I can call it, which he's going through himself. So, Dr. Wahi, few words on COVID-19, your experience, personal
Thank
experience,
you, Vivek.
and
Good evening
also
to
and
all.
also do talk about the integrative medicine which we are talking about with Dr. Claire and Dr. Nesri.
Wonderful for me, Renee. Of course, let me say one thing very clearly, that two factors especially have been making me prone to get the attack. Why? Because number one, age factor. I'm 79, I have completed. And another area is that I'm exposed to the patients, and my clinic being a congested area of Chandni Chowk, Delhi, I'm getting a lot of patients, where this social distancing or the other norms, they are not even possible in cases. But what is important is one should always have a positive attitude. And what I have observed in my own practice is the complications have been there in those cases who have got much more fear of the problem rather than the problem itself. Of course, I would not say that successful in all the cases. I know how upset I was when I lost one of the patients. But since on different webinars, I tried to contact and give all these, there was a assessment, unanimous judgment from various points that in that particular case, it was more because of fear. So fear is an important factor, and you would have a positive attitude. Now coming to my own case, which is very important. This was on 12th of this month. There was a lot of pollution in the air atmosphere that day. And when I went outside, I definitely got exposed to it with a lot of throat irritation. And evening, when I came back from my clinic, I got, after taking my bath, I started feeling shivering. And later on, I got the fever. It was so, then obviously, there was some problem in thought maybe I'm developing pneumonia like symptoms. Immediately, I got the PCR test done, RT-PCR test was done. Next day, it was confirmed that I'm COVID positive. Now, and my CT level, it was 17.31, which again needed immediate consideration. And what I did was, I got all the tests done, and including the CT chest, HRC, I did. So luckily, all the other parameters, they were all normal. I give the credit to those two things. Number one, I have been exercising regularly with the deep breathing exercises, which are very important for all the respiratory complications. This perhaps is one thing which has helped me. I did get fever, and only on the pressure of my family, on 13th of night, I took a dose of paracetamol. Otherwise, even that was not required. The only problem I got after that was a lot of acidity. But other medicines, when I took, Econite was taken on the very first day. Second day, when I started having headache, and my body temperature was, extremities were lower, so belladonna was indicated. So based on the development of the symptoms at different stages, I kept on taking the medicine. And can you believe that my chest discomfort, it was all cured with Pranayama. And right from 17th of this month, I got fever on 12th. From 17th, there is no fever, no chest discomfort, no symptom of any kind, excepting that, yes, it's a forced banvas, as I call it. Otherwise, all the parameters, they are all normal. Now coming to the integration part, which is very important, I have focused as the exercising part that I have told you already, plus the immunomodulator diet part. That, of course, which is very nicely prescribed in the Ayurvedic system of medicine, that I have been doing. And some protein diet, of course, daily I'm taking. And otherwise, absolutely no other, even briny I have not taken since 18th of this month. So it is already 6 days more. And my all parameters, daily I'm checking my SpO2 level, pulse, and temperature. Right from 18th, At 17, there is no fever, and right from that time, no other complication as such. Excepting that, since I'm confined now, the only problem is that in the absence of the loss of a lot of physical activity, there appears some weakness, which of course it will be. The two doctors, both Dr. Claire as well as Dr. Nesi, as they have pointed out, my own feeling or my own suggestion is, it is better to begin with in the government sector, we should have compulsorily all the Ayush departments attached to them. Why? Because if at all, we are going to have separate hospitals for different systems of medicine, it is going to be much more cost effective. And why to avoid, more and more money, we can do that thing, in an integrated manner. The laboratory investigations, they are common for all, have to be accepted by everybody. So that is the area where, we can take the help of the specialists and super specialists also to get what investigations are required, and only to assess whether we are heading for any cytokine storm or some other complications, so that all the actions they can be taken control very nicely. I'm confident in my own practice. What I have found, that number of cases where arsenic album was given to them, even if they have the attacks, they were milder. Complications were minimum. As I said, only one case, of course, that of course, it was of such a nervous temperament that he was not at all willing to go to the hospital. I said, no, I cannot handle, because you are under the heart attack now. So there was a cardiac attack at that time. And thank God, within 2 hours, they could rush to a good hospital. But unfortunately, after another 5 or 6 hours, the person collapsed. He died. So that was the unfortunate incident also, which perhaps, had the person decided to be comparatively positive, maybe, I'm using the word maybe, because his age was not that much. He was, I think, 56 years of age only. Comparatively, in our all neighborhood, etc., I have found that wherever there the persons are more panicky, they are becoming more and more either having problem or they have died because of that factor. So positivity is very important. Regular activities are again very important, and we should not have the fear of corona. Because what I say that, it has been all like so many other viral complications, most of them, which have been respiratory. So we have to treat every case, as it comes, without having a prejudice of COVID or some other complication. We have to take it as a normal influenza case and keep on observing very clearly, and the investigations which are required only to assess whether we are heading for any cytokine storm or not.
Right. Right.
That is very, very important. And integration is the need, going to be the medicine of the future. That's what I feel. All the emergency conditions, yes, we have got very good allopathic hospitals in the conventional system, and they are doing best. Nevertheless, but in case overall, we are having the Ayush departments in all the hospitals, I'm confident that the rate of improvement, that would be much more, and serious complications would be less, is how I feel. The data, etc., I'm not giving it is because, that has been already been given on various platforms by our CCRH. They are doing all the development studies and the other studies also. And the good part was that the Nanopathic College and hospital in Defense Colony, which was a COVID hospital for some time, only, of course, there were many restrictions.
Right. Right.
It has to be acted as in supportive therapy. Personally, I'm not wrong. So that is the need of the hour.
Okay. Thank you. Thank you, Dr. Wahi. I think
Anything else?
Thank you, Dr. Wahi, for your inputs and for um, taking us through your own experience. I just like to have a quick question with Dr. Claire. Dr. Claire, you see now Dr. Wahi's own case, and we had these 400 patients again getting cured at AIMS Ayurveda. How do you patch up this with your joint studies and to be published so that all this information and all this experience of curing patients through other pathies is also recognized, duly validated with a stamp? So what would be your suggestion there, Dr. Claire?
So Dr. Wahi made a very relevant point that we have a very good number of modern hospitals, government as well as private. So instead of creating separate institutions for Ayurveda, I think there should be a department of Ayurveda in all these hospitals. So when these two people are together, they meet each other also and they see each other, and then they can, it's much more easy to sit together and discuss the protocol and work together to get out best out of this integration. uh, but one thing has to be realized that sicker patients, for example, modern medicine is much more effective in acute medicine. Emergency medicine, I will be very reluctant to depend upon anything on Ayurveda. But when we go to the mild to moderate cases and when we go to the preventive aspects, I think Ayurveda has not been properly exploited. And that is the need of the hour, because if you are able to prevent the disease, or even if we are able to make sicker, more chances that patient develops corona, but he develops a mild disease like Dr. Wahi himself. And there are many patients, who have positivity, but they have very little symptom. They are mild symptoms. So mild to moderate symptom, they do pretty well. So if we can decrease like just the potency of the virus by using Ayurvedic methods, I think it will be going to be very useful.
Thank you, Dr. Claire, for this. And Dr. Claire saying again that milder cases can be treated. We can probably have units of alternate medicine in the large government hospitals. We'll come back to Professor Desri on that. But before that, let me ask Dr. Tiwari, Dr. Himanshu Tiwari. Um, you've been in this field for, I think, decades, the Ayurveda field, yet again. And you also work for an organization apart from being Ayurveda doctor. You also prepare a lot of formulations, and so what do you have to say about the integration and also the point raised by Dr. Claire? How do we document these and how do we publish the results, joint studies, so that let me say the modern medicine doesn't talk about anymore that whether this pathy is verified or not, and where is it documented? So over to you, Dr. Tiwari.
Uh, Thank you for giving me chance for this in this platform. Just try to share my presentation.
And while you upload that, I must also say that we will have the technology aspect of how we can work through technology on all these fronts. A presentation made by our speaker and sponsor, Mr. Sawa, right after this. So
Uh,
over to you, Dr. Tiwari.
Presentation is there.
Yes, we can see it.
Okay. First, worship of Lord Dhanvantri, God of Ayurveda. Namami Dhanvantri Mahadevam. Now, from the beginning, Tanuja and Sri Madam have explained many things about the Ayurveda and COVID. I will just come to some problems and treatment of in India. What is the COVID in India? The current therapy of COVID-19 involves only symptomatic treatment and prevention of complication No specific drug on targeted is available. The best would be the primary prevention by reducing exposure to pathogens, arresting progress, and enhancing individual immunity by using the natural immunomodulating agent. In the beginning, everybody is talking about the immunomodulating Rasayan therapy, in which Ayurveda is called Rasayana. COVID-19 is purely an infectious disease, causes complication in persons weak in natural immunity. Uh, Post-COVID conditions may correlate with the state of Ojak Shaya. Rasayan Chikitsa can be used both for preventive as well as curative. Ayurveda recommends local and systematic prophylaxis measures for diseases that are beneficial in COVID-19 prevention. Uh, this include the use of medicated water, mouth rinse and gargle. We are talking about the steam inhalation, oil application, and use of rasayana as immune strengthening therapy. Reasonably good empirical evidence is available in support of these measures. Documentation is there. All these things, what we are telling and what we are going through this, everything is documented in the historical books which we have. Charak Samhita, Shushruta, all these things are given there. In the modern parameter, the clinical trials, as we have discussed, 60 to 70% clinical trials, CTI registration is in the Ayurveda Ayush sector. So it is going on uh, system. The use of non-pharmacological approaches such as the psychoneuroimmunity for the prophylaxis that include diet, sleep, and immunity boosting is gaining attention. That is the dincharya. Aapko din mein what you have to do from the morning to evening, the routine of your lifestyle. The Ministry of Ayush released the independent advisory of people of the self-care, which has been received good response. The Ayurvedic Rasayana are known for the immunomodulation and the regeneration properties, which are important in COVID-19 management. I'm talking about Rasayana. Rasayana therapy is one of the 8 major clinical disciplines of Ayurveda. In nutshell, Rasayana increases the resistance of the body of any onslaught. This is the advisory given by the Department of Ayush, the common signs, symptoms, cough, malaria, fatigue, all these things. And the mainstay in the management of the infection has been supportive care, nutrition, and preventing further progress in the absence of any antiviral agent or vaccine. There's an immunity factor. If your body immunity is good, you can clearly all these things. Then the approach of the Ayush system, the holistic approach of Ayush system of medicine give focus on the preventive through lifestyle modification, dietary management, prophylactic intervention, improving the immunity, and simple remedies based on the presentation of the symptoms. Symptomatic, you can say that the treatment can be symptomatic for that. For instance, emphasis on the evidence of the causative factor and enhancement immunity against host of infection are characteristic of the Ayurvedic management. Now, the approach to manage the outbreak broadly comprises of the preventive and prophylactic symptom management of COVID-19 like illness, add on intervention to the conventional care. Based on the potential and strength of the Ayush system supported by the evidence, it helps in improving the respiratory symptom in similar disease disorders and recommendation from the Research Council and the Ministry of Ayush. Some preventive and prophylactic treatment what given in the Ayush protocol, that is Samshani Vati, that is the Guruchi converted, Sodia cardifolia, the extract of that. And in Siddha, Nilavim Kodinir, just like in the Siddha medicine, it is going on, that is the Endoclophis paniculata, Kal Meg is used for that. In Unani, preparation of decoction of boiling Behi Dana and some Jaipes Jujeba in 5 in number, and then Substan 9 in number, and boiling in 250 ml of water and keeping reducing and then filter it. These are the antioxidant activity, immunomodulator, smooth muscle relaxant activity, and anti-influenza activity. Down the symptoms management of COVID-19 like illness, same one IU64 drug is a tablet form given by the CCRS, Central Council of Research in Ayurveda. Agast Haritki, 5 gram twice a day, and Anu Telas or the Til Tel, sesame oil, for the nostrils, to put 2 drops in both the nostrils. All this medicine should be taken in the consultation with the qualified physician. Self-medication is not there. In Siddha, given by the Ayush system. Add-on intervention onto the conventional care, that is the Ayurveda, IU64 is there, Agast Haritki is there, Siddha, same thing. Good preventive measure, already notified, everybody knows good personal hygiene, frequent hand washing, all these things, wear mask. In addition, the following Ayush specific measures may be adopted. The diet should be fresh, warm, easy to digest, containing whole cereals, vegetables, etc. Frequent sipping of water boiled with tulsi leaves, turmeric will be beneficial. Honey with a pinch of pepper powder is also benefit in cough, cold, frozen, heavy foods may be avoided. It is also benefit direct exposure to cold breeze. Now the season is coming for that. Appropriate rest and timely sleep are advisable. The yoga asana and pranayama under the guidance of qualified yoga instructor should be recommended. Common medicinal plant useful similar just like tulsi, Ostium sanctum, guduchi, Tinusura cardifolia, ginger, Genifer officinalis, and turmeric, haldi, curcuma longa. This thing, Ministry of Ayush recommends the following self-care guidelines to prevent measures and boosting immunity with special reference to respiratory health. These are the Ayurvedic literature and scientific publications are there. In this slide, preventive care of dincharya, daily regime, and ritucharya, seasonal regime. What should be done when the season is going to change, and what the routine of the daily of a single person should be there. I'm just giving some points for that. Recommending measure for the your dincharya. Wake up between 4:30 to 5:30 in the morning for 45 minutes before sunrise. Drink 1 to 3 glass of warm water. Gandush cover, that's a oil pulling, 1 tablespoon of sesame oil or coconut oil. Gargle with warm water added with a pinch of turmeric and salt. Nasal health, Pratimash nurse, that is the 2 drops of sesame, coconut or in nostrils. Daily practice of yoga asana, pranayama should be there, and warm water bath. In afternoon, don't sleep during the daytime. Involve in work from the home, indoor recreational activities like studies, etc. In evening, meditation, pranayama for 30 minutes. Dietic, eat only when hungry in the appropriate amount according to digestive power. Always take a fresh and warm diet. Eat easily digestible food. Take dinner before 3 hours of bed. Time till 8 p.m. Chyawanprash is recommended by the government of India Ayush Department. Take Chyawanprash 10 gram 1 tsf in the morning, and for diabetic patient it should be a sugar-free Chyawanprash. Drink herbal decoction. Ayush Khada is recommended by the government of India, that is Ayush Department, and golden milk, half teaspoon haldi with 150 ml of hot milk. Now we are, I'm not going to detail all these things. For the immunity boosting, we have the Samshani Vati, Ayush Kwath, already described, Giloegan Vati, Ashwagandha powder, Muleti powder, warm milk with haldi, that is a golden milk, gargle with turmeric and salt, Chyawanprash, already discussed. There is the Ayush Kwath given by the Department of Ayush. Tulsi 4 part, Dalchini 2 parts, Shunthi 2 parts, and Kali Mirch 1 part. One sachet of dissolving, that is a 5 gram, 150 ml of boiled water once or twice a day with the mixing of draksha, jaggery, or lemon juice in that.
Dr. Tiwari, if you could also enlighten us on the integrated
yeah,
approach,
I'm coming to that. This is the plant details about that is the properties of antiviral, anti-inflammatory, anti-modulatory effect of the tulsi and dalchini, shunthi, piper longum, piper nigrum also, kali mirch, sorry. And there is a one Kuka immunity booster tablet developed by Multani Pharmaceuticals. In this, tulsi, makoi, giloy, muleti, vasa, all these things are there. And we are running a clinical trial in National Institute of Ayurveda, Jaipur. Within 2 or 3 months, we will get the result of that as an immunity booster. There are some properties, antiviral effect, anti-inflammatory, all these things given for all the drugs in that formulation. These are some aspects of that. The Ministry of Ayush is making serious efforts to promote culture of collaboration without losing the basic principle of the respective system. Ministry of Health and Family Welfare is also encouraging integrative approach. The establishment of an interdisciplinary Ayush research and development task force for COVID-19 is a positive step in this direction. actively promoting the Ayurveda, Siddha, Unani, Swaripa, homeopathic medication, yoga, and naturopathy interventions, showing empirical evidence might benefit with a minimal potential for harm. More research is certainly needed to confirm this. However, in the exceptional case, COVID-19, use of this safer option needs to be adopted. In my view, this what we can intervention of the all the pathies, Ayurveda ho, Unani ho, Siddha ho, all these things, even allopathic, should be in a combined form. We were discussing that in every modern hospital, Ayurveda department, Ayush department should be there for a good research basis. Thank you.
Thank you, Dr. Diwari, for the wonderful presentation. Mr. Sehgal is about to join again. I would now request Mr. Sava to give his presentation, please. Mr. Sava, over to you, please.
Hello, hi. My name is Sava Jovanovic. I'm director of VIOM and TP, Technology Partnership from Serbia. And okay, I would like first to apologize. This is for I'm for the first time being a panelist in India. Such an important event, and also something like so. Please apologize. Please accept my apologies if I do something wrong and if I'm not the most eloquent person. Not to explain, I'm the most an excellent engineer and doing some trying to connect digital and real world. I would also like to give you something a bit about my background. I am in technical, in financial, but also my family. We were quite an established family in medical world. For example, my aunt and uncle, they were quite established virologists and infectologists. And particularly my aunt, she was working with COVID virus 40 years ago. So I understand something about this disease from the medical point of view as well. So I'm going to try to share our presentation. And I hope that you see. Sorry, this is the wrong one. I have to stop now. Sorry, now to share again. Okay, do you see it?
Yes, we can see it. Please go ahead. Mr.
Okay,
Sava.
so what we want to do is really to help connect digital world with real world, and really to make it easier for everyone in the real world to use all kind of established services. And this is what VIOM and TP, what we are working together. You could say this is a health 4.0, like industry 4.0. This is a health 4.0 revolution. What is the problem? At the moment, we talked quite a few, and one of the estimated guests, he mentioned that there is quite a lot of people, when people try to get somewhere, that there is a big crowd. And that is also could prevent providing them the best possible service. They're also getting sometimes too late to get a proper treatment, but also this some of the people will get infected. So what we are trying to do is really to provide an easy way for people to get in touch with appropriate medical services, to improve prevention, because prevention care is the best way to cut down any kind of cost, but also to provide people with the best possible treatment in the right moment, in the right time. And this is something like, and together with VIOM, what we are trying to do is to provide such a kind of service, integration of digital world and integration of smart care centers in across India, and particularly as we are working in the rural part of India. So this is what we are using. We are using Internet of Medical Things, and idea is to with pretty basic system, so something like not very expensive, to provide smart care centers in such a way that everyone would be able to attend to prevent to get something like a first triage kind of medical examination, and to help them to see if they need to meet a doctor, and if they need to meet a doctor, that they will be immediately be sent to appropriate kind of service. And this is what we are trying to do, to help really in a very cheap way to establish medical service for everyone who was either very hard to get to medical service, or at the moment they are scared to go to hospitals or to some other kind of service providers, medical service providers, because they are scared of being infected. And medical, this is where we are getting with our solution. So we are providing digital solution for mobile for people and smart care centers. As what we want to do is completely cover completely India, particularly these rural areas, with very cheap and very affordable smart care centers that are going to be operated with paramedics to help people with prevention, but also to ease on making huge gatherings. Because, particularly, let's say, huge gatherings, even in the open, they are going to help spread this disease, because this disease is very probably airborne and transmittable through very small droplets, air transmittable. So even if you're in open, you can get infected. And unfortunately, a few days ago, head of our Serbian Orthodox Church, he died because of COVID. And he got infected on a funeral 3 weeks ago. Or another high-ranked church official. So this is just showing how dangerous it could be. They are old people, but healthy, and still we had something like a huge loss. So this is something what we want to do, to make easier for people to get appropriate. So this is something like what we are offering. We are offering the complete system. So including modern medicine, but also including Indian traditional medicine. Idea is we believe that this is something like that they're not adversaries. We believe that they can provide something like a proper kind of service, and that they can work together to provide the best result for everyone. This is something like some unique points of sales of our system. And as you see, we are going to provide very simple ECG, respiratory measurement of respiratory systems, blood oxygen, and blood sugar. And these are something like first basic kind of measurements. They can give you quite a lot of information about that person. Because blood pressure is something that kills often, but it's very often neglected. ECG is going to show quite often if there is any problem. Respiratory measurements are now pretty important because of the COVID, but also measurement of blood oxygen. And these are the things that if you are sooner going to get a treatment, you are going sooner to be treated properly. And also, the sooner you are getting treated properly, the less people are going to hospitals, the less people are going to emergency rooms, the less people are going to intensive care. The less people go into intensive care, the more people are going to survive, because your health system is not going to be completely overwhelmed by this current disease. And it is pretty dangerous, as I mentioned, and quite, for example, at the moment in Serbia, and not in the whole Europe, medical systems in the whole Europe has been completely overwhelmed. And there are quite a few hospitals, the specialized hospitals, just this is like military hospitals in big sports centers, and now gathering something like 1,000 people. For example, in Serbia, this is something like there are a few hospitals with more than 1,000 beds only for COVID patients. In the UK, they have 5 hospitals with more than some hospitals up to 4,000 beds just for COVID people. So this is something. Prevention is something that is going to help keep people healthy, but also prevent from them infecting other people and also from them becoming serious patients. Our solution, as you see, this something like we made something like a short comparison what we are doing and what we are traveling, what we are providing, and indeed what we are doing, what we want, everything was needed, and particularly to cover rural India with schools and with smart clinics and smart centers to provide, so when doctors are in field, that they would be able to provide the best service. Also, they would be able to get all results and to make the research based on that. And that would help them to prevent not only to go through not only this kind of disease, but even further in the future through any kind, because the more people there are, they're going to be in the future, in the next 5 to 10 years, something else is going to come, and we should be better prepared for the next. COVID is going to end probably next year, but we should be ready for the next one, and it's going to come sooner, unfortunately. Sorry. Novelty. This is something like we are providing everything, and what we are targeting is really much the complete system, to cover the complete health system. With something about our company as well as Vyom. Vyom is we are working together. Vyom is providing and working on a smart care centers in India. They started first few in India, and we have finished using our own technology. So we are covering complete security. So what we are providing is a very secure system based on our security on ISO 9001, 27001, but also for our payment system. And we are ready to share everything with, to provide the services in India, but also to share everything with India. Okay, this is our basics model. Something like, this is our, something like you could say, what we are trying to complete. We started to work several years ago when we met in India, when I was visiting India, basing on our smart cities. And we started our development of the system 2 years ago, and the system is in production in India since beginning of September this year. This is our team. This is something like working on a system together with Indian and Serbian team. And this is what we are looking to achieve. And I believe, we all believe that we can help not only in this situation, as I mentioned, to help people get proper attention in a way that they are not going to feel stressed, because stress kills, as we know. It's not only that virus kills, stress kills as well. As the more we are stressed, the easier virus is going really to affect us. If we are providing all this kind of service in a way that people are going to say, okay, I don't have to go there when there are 10,000 people. Of those 10,000 people, probably 2 are already infected. I don't really want to get there, because it's the probability for me to get infected is something like 20, 30%, maybe 50%. And if I get infected, if I'm 60 years old, if I'm sick, if I have a diabetes, if I have a heart condition, I will it's going much with high probability is going to affect me much more, much harder. So what we are what we want to provide to those people is really an ease of mind when they want to get a medical support, so that they can go somewhere and know that they're not going to get infected, but they will be able to get at least initial kind of examination to tell them, yes, you are very probably, you should not be worried, or okay, you might be worried, but because people are, these systems are dispersed, you're going to get a proper attention, either remotely or directly. You will get somewhere with much better kind of time management of the health system in India as well. As I mentioned, something like we already have some first smart centers by P in India. We already have our production system in India. I'm inviting all of you to send me. I sent my email, and I'm inviting everyone to send emails so that we can provide you a demo of our system. And also, I'm inviting you. I will send you a link to Beyond Smart Care by P application so that you can download it, and so that you can see what is it or how it works, and so we can talk, and then you can say spread the word, because we believe that this is really something that could be of help for everyone, not only for this crisis but for the system itself, to provide services to many of those that were not able to have a service in the past, and also to have for the next crisis that will come in next 5 to 10 years. And these crises are coming regularly, unfortunately, nowadays. So this is something about our achievement in rural India. And this is our partners. As you see, Myom, CDOT, we are working with them, and I hope that we are going to work with all of you in the near future. So if anyone has any question, please let me know, and I try to answer questions now immediately, or you can send me an email. I can provide also my telephone number if you want, if you would like to send me questions via, for example, WhatsApp or via our own platform, P Framework. So this is something like at the moment, I believe that only if we work together strongly and provide a system that is going to help both doctors as patients. And when I say doctors, I really think that all doctors are extremely overwhelmed by current situation and current problems with the number of patients and severity of some of them. And also with the patients that are at the moment put aside, because I'm not sure about India, but here in the whole Europe, quite a few patients of other diseases are completely neglected. So this is something like the morbidity from heart diseases, from cancer, and everything else is rising sharply because they're getting neglected. And it's much harder for them to get even an examination, because in order to get an examination, a patient, or to get to the hospital to have a small operation, there is a complete procedure that lasts days. PCR tests, what if, what now, how to operate, who is infected, everyone is worried. So let's give everyone a fair way to get proper treatment.
Okay. Thank you very much, Mr. Sama, for that wonderful presentation. I think we have learned a lot about your product, and we're really impressed by your partners which you have already in India. And let me put out the first question, because though we are running quite late behind schedule, as usual, it does happen in all these interesting webinars. I have this quick question for you. You know, we've been talking about integrative health mechanism for combating COVID-19 now, all this evening. And you heard the doctors from different fraternities. Now, how can your platform, because I see technology as a major player in, handling the COVID crisis. So can you tell us as to how can your platform, if at all it can, um, combine the advantages and the treatments and the kind of patient consultations across homeopaths, Ayurvedic doctors, and modern medicine doctors, and especially in cases where milder cases can be taken care of by the homeopaths and the Ayurveds, and it's only hospitalization cases which need to go to these modern medicine doctors. So can your app do something like that, which may be of tremendous value to the patients at large as well as the doctors?
I believe we can via triage and via some questionnaires, and also it's not only by our app but also via our network of integrated smart care centers, because this is our huge advantage. We are integrating digital and real world. This is not something in a cloud that you have everything that you have just on a phone. We are working with the real people that are in a field that can help immediately. So that's a huge advantage, and quite differentiator between us and anyone else. So, for example, you could get something like a potential patient could say, okay, these are my symptoms. We already put that kind of a small table for patients. They can ask something like, okay, get in contact with the appropriate person. That person could start, say, okay, let's go there. If you can get something like helped by homeopathician or with Ayurveda. Sorry that I'm going to pronounce it wrong. Ayurveda. So yeah, I'm sorry. Ayurvedic, yes. And then this is something like, and then they can go further to if those people see that this is something like maybe a more serious, that they can immediately forward them to appropriate other doctor. The question is always about how to make this situation, how to help all doctors in a way that they are not going to get really under tsunami of patients.
Right, right.
So everyone should be there to do, you could say, his or her duty to help everyone else. And our goal is to help all of them to help themselves, so that patients are getting faster with appropriate people, and the doctors they have something like an easier way to get an easier number of people getting in contact with them.
All right. So thank you, Mr. Sava. I
Thank
think
you very much.
I'm sure this platform, if properly leveraged across all our stakeholders, I'm sure can bring in a lot of synergy, and also ease out the complications, and probably at the end of the day save a lot of lives when it comes to handling cases on an emergent basis is concerned.
I believe so. I can give you something. I was a skin donor 20 years ago to help save some man's life. So I'm also blood donor. So I'm also on the list of the people for the what's the name for when you are donor. Sorry, I forgot. This is for the bone marrow.
Bone marrow.
Yeah, Ben. Yes, I completely understand. And our main goal is to help people through to get a better treatment, not only today. Today is extreme, but even tomorrow. And this is something like this is something that we want to point. I would also like to ask everyone, please get in contact. I send my short email address. If you need, please let me. But I believe that you would be able to help us as well, so that we will be able to demo everything, and to send links to everyone to download our application, but also to get in contact with us, so that we start working with everyone and make it faster to establish this network of smart care centers around India to help not only in this situation particularly, but not only in this situation, even tomorrow. And thank you very much to everyone.
Thank you, Mr. Sava. I really don't think we have time for the question answers, though I have been asking most of the questions to the panelists, whatever have been coming up in the chat box. And I will request all those who have had any questions which have remained unanswered to kindly write back to us on the email IDs which sent you the invitations for this webinar. And I would request our backend team to kindly put in Mr. Savar's email ID and phone number, which can be used for WhatsApp, into the chat box for the benefit of all the participants, so that it's easy for them to get in touch with him directly. So Amit, I hope you can do that quickly and put it into the chat. And with that, we do come to an end of an interesting program, but I think more than an interesting program and a knowledge sharing platform, I think we've done a bit on as to how we can actually look at integrating this medicine. And at this point of time, I think one of the strongest suggestions which has come from across the board is the fact that there are a lot of these government hospitals, especially the big ones, and why not the smaller ones a little later, to have an integrated approach and have the wings for homeopathy, for Ayurveda, and why not even yoga before we go into Unani and Siddha. So one strong suggestion coming from the doctors and the private hospital owners and people working in that area in the industry. And of course, we are really impressed with what I think Professor Nesri is doing back at AIMS Ayurveda, treating patients. So I think a lot of things have come about which are ready for action. And we as a chamber would like to take initiatives on this front and continue to create similar platforms so that we are able to connect all the pathways together and they can actually start working for easier, quicker, and safer healing for all of us. With that, my profound thanks to Professor Nesri, Dr. T.S. Clare, Dr. R.N. Wahi, Dr. Himanshu Tiwari, and Mr. Sava for being here this evening. And Madam, we will continue to be in touch with you. And we would like to see a lot of things taking up shape between the industry and AIMS Ayurveda for integrated medicine.
Sure.
And we will definitely take your help in proposing to the government to set up Ayurveda units and homeopathy units and maybe yoga units in all government hospitals
Yes,
as we
that
go
would
along.
be a great step. Thank you.
And I think that can be an immense initiative and contribution by AIMS Ayurveda.
Thank you.
Thank you.
Thank you very much as well.
Thank you.
Thank you.
Thank you.
Thank you. It was a great, we also would like to have this digital solution Dr. Sava presented. That was really good.
Thank you very much. And I would like to get in touch.
Yeah.
You have some my details. So please contact me so we can talk sometimes in the next couple of days.
Sure.
Thank you very much.
Thank you very much, Mr. Sava. We will connect you to Dr. Nesri by sharing her details too. And you have already shared your details on the chat message. Thank you very much.
Thank you.
Thanks goes to all the participants. Second team, wherein we have Siddharth, we have Amit, and also Dr. Ravi. Thank you, gentlemen, and have a great evening ahead.
Thank you very much as well.